Hello, my name is Professor Sir Mike Richards. I'm the Chief Inspector of Hospitals. My task is to inspect all hospitals in this country, but also mental health trusts, community trusts and ambulance trusts. What I'm here to do today is to answer your questions both on camera and on Twitter. That's a very important question. We are absolutely committed to taking the views of patients into account in a number of different ways. For each of our inspections, we're going to hold a patient and public listening event, probably in a town hall near to a hospital, where we will gather everybody together and say, tell us what you think of the hospital. That may be good, that may be less good, the comments people want to make. We will also look at any comments that are sent into CQC, we will look at complaints that have been sent to the hospital, a range of other sources, and we'll work with Local Health Watch on that. But the proof of the pudding is, do we actually then respond to them? I think one of the things that we will be doing is getting our inspectors to hear what's being said and then to go and look for the evidence in the hospital of that to corroborate it. Discharge arrangements are going to be an extremely important part of our inspection. We will be looking at that in each of the departments that we go into. So in the A&E department, or in the medical wards, on the surgical wards, or in maternity, we will be asking patients about that, we'll be asking staff about what the discharge arrangements are, to make sure that there really is true integration, both with primary care services and with social care services. So we have already said this is going to be an absolutely integral part of our inspection process. We will always have a pharmacist on the team if we have reason from the data that we've gathered to think there's a problem. That doesn't mean we will have a pharmacist on every single team, but we will always have nursing and medical staff who, after all, do know an awful lot about drugs, looking at the safe management of medicines in the hospital. And if we find anything that requires follow-up, we will then get a pharmacist to come in and look. I think in terms of the learning environment, we need to look both within CQC at how we become a learning organisation and then how we can share the learning from our inspections more widely. Both are very important. We will be providing training for our inspectors and for the experts that join us on our inspections. And we are committed to being a learning organisation, but we're also committed to sharing learning that we get from all these inspections with the NHS as a whole. That will be a very important part of our work. I think it's important to say that there is a lot of good care in the NHS, which is very much centred on the individual, but the questioner is completely right that sometimes the care isn't centred on an individual. That is why one of the domains that we are looking at in our inspections is whether a hospital is caring. And we can look at that in a number of ways. We can ask patients and the public, we can look at any complaints to see what's happening there. But importantly, we can also look at patient survey data, where there are specific questions on that. So we will be looking from a variety of angles, and of course, we will also be observing the direct care that's given to patients on wards. If I'm totally honest, the answer to that one is not yet. We've only done 2 inspections and they're not yet complete, so I can't absolutely say that. But what I would say is that we are basing our approach on bringing together the best of what Sir Bruce Keogh used for his review of 14 hospitals and what the Care Quality Commission has done in the past. We're blending those 2 approaches, and I am confident that that will work, and I've discussed it with a lot of people and they seem confident too. But the proof of the pudding will be when we've actually done these inspections. Patient feedback is going to be important in all sorts of different ways. It's going to be important in terms of the listening events that we will be doing. It'll also be important from complaints or comments that they've sent in to us. Actually listening to patients when we're on the wards or in the outpatient department. We will gather all that together, and that will give us clues as to whether we need to be looking in a hospital, and then we will do that direct observation of care. Simple answer, yes. We will look at medicines management in all of our inspections and in all of the different areas that we go into. We will look at how medicines are being handled, how the drug charts are being used, whether the way that nurses give out the medicines, all of that. And so medicines management will be an integral part of our inspections. Thank you very much for these questions. If you want to know more, do please follow us on Twitter, subscribe to our YouTube channel, or visit our website.